Hi, this is Dr. Wei. I am an OBGYN in Irvine, and I'd like to talk to you guys about the HPV vaccine. Can you give it around the time you're going to be pregnant? Can you give it during pregnancy? And what about afterwards while breastfeeding? So if you're trying to get pregnant and you're preparing, it may not be the best time to get the vaccination, not because it's not safe, it's because it is a three vaccine course. And so if you administered the vaccine and you became pregnant, you would not finish the vaccination course, and you would still wait for after you deliver, which can interrupt with the course schedule, and you may have to redo the whole thing again. During the pregnancy, it's not advisable to administer HPV vaccine. It's not that there's any evidence that show that it's harmful. It is an inactivated vaccine. That means the virus is dead. There's no active viral particles in the vaccine, because if that's the case, that would be potentially dangerous. However, an HPV vaccine is safe enough in pregnancy. However, if you're not in such a high risk population, it is not advisable, which is the case for most medication in pregnancy. If the benefit is not going to outweigh its risks, it really isn't advisable to give anything that we don't have that much information about. But let's say you did get the vaccine and you found out later on you were actually pregnant. Would you terminate because of that? We usually would say no. Just purely by that information, there is no data suggesting that the HPV vaccine would cause harm to your developing fetus. So for that reason, purely, we would not recommend to terminate the pregnancy. But if you know that you're pregnant, we would just not continue the rest of the vaccine course. So after you deliver, it is very safe to vaccinate with the HPV vaccine. It is safe to do so with breastfeeding. And you can talk to your provider about the scheduling of the vaccination. But we recommend after the first shot to do the second one in 1 to 2 months, and then 4 months after that. So if you have any further question, please feel free to contact our office or see your provider for further instruction. Thank you so much.